Hi, everybody. Happening in Fulton. The Fulton County Manager provides an update on the latest on everything from COVID-19 testing to the vaccine. Here's Mr. Dick Anderson.
Well, thank you, Shania. I'm glad to be here. We're at 4700 North Point Parkway. I'm here with Ann Lee, the CEO of CORE, our key partner in all of our testing and now vaccination efforts.
How are the COVID trends and how has the partnership with CORE been beneficial?
Well, the good news is the trends are definitely improving. As we have talked before, we definitely saw a spike in January and February. Our new case count is about 1/6 of what it was during that period of time. So we're at about 100 now new cases a day. So it's not gone away by any stretch. So many of the same mechanisms in terms of social distancing, hand sanitization, and the like still apply. But of course, the focus is now on vaccinations. But before we get there, let's talk about testing. I think testing for Fulton County has been a strong suit. And one of the reasons it's been a strong suit is the partnership with CORE. And I want to just say to Ann, she's truly one of my favorite people. And having known her only a short period of time, but they have just been phenomenal in terms of being an effective partner, but truly being a mechanism to get into the community and reach out to folks who might not have otherwise considered being tested. And that testing, and now I think we're at 1.7 million people tested in Fulton County. And that represents almost 25% of all the tests done in Georgia. So just comment about how this partnership came to be and how your firm does what it does, particularly with the mobile testing units.
Sure. We first came out through the Arthur Blank Foundation. Frank Fernandez brought us out to do a testing site at the MBS Stadium. And really, it was meeting FCMA that really allowed us to kind of expand exponentially, not just with testing, but with other activities. And it's just been such an incredible partnership, not just because of the ability to scale, but really learning so much from the FCMA team as well. The fact that they give us so much support when we need it, and we're almost like a one-team approach, really allowed us to do what we do. So we love you, Dick, and we love the partnership that we have here.
And the mobile units, why are those so effective, do you think?
The mobile units are so critically important. It's really an equity issue to be able to go out to the communities in need and really make it very accessible. What's so important, and we're looking at the numbers just across the United States where we have mobile units, the folks and the demographics that we're trying to target, and that is Black and Latinx communities, are the ones that come to those units because we make it accessible, we make it easy to sign up, and just visibly in there in the community. And we partner with phenomenal local organizations as well.
What's next with the Mercedes-Benz Stadium announcement, and what is expected for vaccinations per week and for how long?
Well, having Mercedes-Benz Stadium is truly a godsend. Not only was it something for early voting, but now it will be the premier vaccination center in the state of Georgia. We started it. CORE is again helping us there as well. But now what we have available is the federal government. And the federal government will be helping to staff Mercedes-Benz Stadium with active military, more importantly perhaps with guaranteed levels of vaccines. So what that means is today we do about 1,000 per site. We're at 4,700. We'll do actually 1,400 vaccines here today. We will move to doing 42,000 vaccinations a week at Mercedes-Benz Stadium. So effectively that triples the number of vaccinations that we'll be doing through our 3 fixed sites. And that's a phenomenal increase. Additionally, and again, I'd just like to pull Ann into this because what we have first gotten a look at is the demographic information on the folks who are taking vaccinations. We had suspected that there was a vaccine hesitancy problem. Now we've got some numbers that confirm that. So the numbers are more or less about 60% of the vaccinations that we've done are going to Caucasians, about 30% to Black, and about 10% to all other. It ought to be 45, 45, and 10. So you can see there's a mix there that we need to change. And one of the ways, Ann, I think that particularly we can change that, again, is with what we learned in testing, we apply to vaccinations. And I think you've got a vaccination program ready to kick off. Maybe you just talk about that for a moment.
Yes, we're launching one unit, and that is a bilingual unit that's focusing on the Latinx community, but that is ramping up to 4 units. And again, that is to create more accessibility and also to address people who have an issue with the digital divide, that don't easily have access to internet or smartphones, where we can be much more, sort of have a higher touch in these communities to help them get signed up. So that's the goal.
And finally, what will Fulton County receive from the American Recovery Act, and what are some of the priorities?
So the American Recovery Act, which has just passed, will provide Fulton County an additional $200 million, about $206 million to be more precise, in resources. More importantly, perhaps, is all of our cities are funded at a like level, in fact, a little bit more. So coming into Fulton County in total will be over $500 million. So the good news in that is twofold. One is it's ample resources. Two is I think each of us, cities and county, will be playing distinctive roles. And what I mean by that, I think vaccination efforts, as an example, is more a county-wide function. So we're planning to double down on the amount of resources that we're putting against vaccination, specifically the mobile units, also advertising and community education. Anything to drive up the rate of vaccination. Our target right now is over 80% of the population being vaccinated by sometime this summer. And I do think that's going to require kind of an all hands on deck, if you will, approach, using every tool that we used in testing and maybe then some. In addition to that, what we'll be looking at is pandemic proofing really our operations. So if you think about all the things that we've had to do this year to scramble, to put together our capabilities, our facilities and the like, both in the public health side of the house, but then also in general operations, we're going to look at how do you put ourselves in the position where if there is another pandemic, that not only can we survive, but we can continue to function in a very high-performing way. I think one of the things that we'll have to do, speaking of our core operations, is as our courts have been closed and we have not had jury trials, we've done some activities there, but not fundamentally the jury trials, an enormous backlog has been created. And if we put the right resources against it, we believe we can work ourselves out of that backlog in a fairly short period of time. So that is going to be a huge priority for our courts. So those things that we've done before, a re-emphasis on vaccines or a doubling of the emphasis on vaccines, getting our court backlog worked out, and then pandemic proofing ourselves for the future, I would say are our highest priorities.
I just have to say that working across the United States, this is the most unique partnership that I've seen, not just here in the United States, but just in the 20 years of experience in doing disaster relief, just kind of bringing us in, having a one-team approach. We really are very grateful to you all.
Well, thank you, Anna.
That's just some of what's happening in Fulton County. To stay connected, be sure to follow us on Facebook, Twitter, and Instagram. You can also check us out anytime on our YouTube channel, so please do us a favor and subscribe. That does it for this edition. Thanks so much for watching. Join us daily for news around and about Fulton County.